access and utilization of health services for children, including immunization and management of common childhood illnesses, have been affected in the wake of COVID-19 pandemic. It is for this reason that the Department of Pediatrics and Child Health, College of Health Sciences, Makerere University, carried out research aimed at determining the effects of COVID-19 on the healthcare access among children less than 5 years, with a focus on the utilization of integrated community childhood management services in Wakiso district.
But what stood out most in our results is that the number of children who are seeking care for common coughs and flu, which we call respiratory tract infections, pneumonia, almost dropped by 48%, both at the VHTs, who are the ones in the community, and the health facilities.
The researchers recommended that Ministry of Health needs to empower lower-level facilities and community health structures, plan for them in the face of diseases outbreak, mainly because they are the primary health providers. Malaria, diarrhea, pneumonia, and injuries were the main childhood conditions for which caregivers sought help during COVID-19 period.
The 50% reduction in the cases of pneumonia over a one-year period, pre-COVID and during the COVID era, that is significant. So the use of masks, the social distancing, is actually an effective, very effective tool that we should maintain in our disease preventative measures in as far as respiratory tract infections are concerned.
But for me, the infectious diseases are the ones that are easy to monitor. But I want you to know that if we did this for every single district, we worked in Wakiso district, but we need to work in the high volume districts like Kampala. We also need to look at the lower, volume districts, the newer districts, to see if the effects are actually the same.
Our study has actually, there may not be new measures, but what we have proven is that even as we're fighting COVID, we also hit another bud. We have, I think, reduced the risk of infections, of respiratory tract infections amongst children.
The Ministry of Health adopted the Integrated Community Childhood Management Strategy aimed at reducing childhood morbidity due to common illnesses. These illnesses include malaria, pneumonia, diarrhea, TB and HIV, whose morbidity is reduced by ensuring timely and correct treatment of childhood illnesses at communities and early linkages to the nearest health facilities. Zahara